Do you work in the animal health industry or veterinary profession? Have you ever wondered how people began their careers and how they got to where they are today? Hi everyone, I'm Stacy Purcell, the founder and CEO of The Vet Recruiter, the leading executive search and recruiting firm for the animal health industry and veterinary profession. I was the first recruiter to specialize in the animal health industry and veterinary profession in the United States and built the first search firm to serve this unique niche. For the past 25 plus years, I have built relationships with the industry's top leaders and trailblazers. The People of Animal Health podcast highlights the incredible individuals I have connected with throughout my career. You will be able to learn more about their lives, careers, and contributions. With our wide range of expert guests, you'll be sure to learn something new in every episode. Thanks for tuning in and enjoy the episode. Hello, everyone, and welcome to the People of Animal Health podcast. Today's guest is Silja Schiller-Moumtzidis. She is a purpose-driven leader changing how the world tackles pet homelessness. With 24 years of global leadership experience across Mars Pet Care, WPP, Johnson & Johnson, and major consumer brands, Silja has built and revitalized organizations on 3 continents. She is the co-founder and CEO of Zero Stray Pawject and Zero Stray Academy, Greece's largest animal welfare advocacy and an emerging international nonprofit recognized for best practice models. Her prevention-focused approach has reshaped municipal compliance, trained thousands of officers, and dramatically reduced stray populations. Silja is redefining what's possible for animal welfare worldwide. And Silja, welcome to the podcast. And how are you today?
Thank you, Stacy. Thank you for having me. It's a true honor to be here. So nice to see you.
Well, it is nice to see you again as well. And I'm so happy to have you on the podcast today. I want to start off at the beginning. What was your life like growing up and where did you grow up?
I grew up in Berlin, in Germany. At a time when Berlin was divided still in 4 zones. I grew up in the West Side in the British sector. Um, It was the end of Cold War, and I was there when the war came down, which was quite an interesting experience. I was a child, but it was a very interesting experience. My dad had a shipping company, and it was quite tough to get inland navigation to get his ships through the communist area. So I was always fascinated how he did that. So he was an entrepreneur, and my mother is or was a nurse, and she specialized early on HIV in the 1980s when the disease was very much had a stigma to it and fear. And what I value very much about my mother was the approach that was deeply rooted in curiosity rather than fear. And she told me many stories, many of them stick with me, um, and probably deeply shaped my curiosity about diseases. How do they start? How do they spread? How can you get cure? How can you cure them? So looking back, I think the combination of my father and my mother, entrepreneur and science, made me the person who I am today, combined with a massive love for animals.
Well, that is so interesting. I was a senior in high school when the wall fell, and I was taking a political science class. So that was front and center being in a political science class. So I remember that vividly. Well, what an interesting childhood. And I am curious, how did you get into the animal health industry professionally?
So I actually I'm not a veterinarian. I did something boring, if you might say that. I studied economics, so I have a bachelor in economics, a master in business administration. I studied in Oxford and Paris, and then I started my career in a corporate job in medical devices at Johnson & Johnson, and then later on moved into the pharmaceutical industry. Stayed there for 10 years. As I said, there was always something about my mother being deeply curious about diseases, illnesses, how they start, how they spread, how do you cure them, what other ways to do that. About a decade later, so now a decade ago, in 2014-15, we founded Zero Stripe Project. Um, and it was originally a shelter and then obviously evolved to something that we have today, which is the largest advocacy and education organization in Greece and also now recognized for global best practice and soon a veterinary organization. We're building up a veterinary team. So during that time, I had um, just gone through the first decade of getting off in the pharmaceutical industry, getting off blockbuster drugs, moving more into precision medicine, moving more into real world evidence, genomics, biotech. And then I started this organization working with veterinarians. First as a shelter, we had a lot of dogs with very difficult diseases, so we had to find the right treatment patterns. And I realized there are a lot of patterns that are similarly to the pharmaceutical industry. So I entered through Zero Stray Project, worked for a decade on that. Now we're setting up a veterinary organization. Later on, I worked at NARS. So I joined Mars actually because of the work of Zero Stray Project. They were looking for somebody who could set up new business models with shelters. So Mars has a very big um, team with breeders, obviously now in the veterinary space, the diagnostic space, e-commerce, pet stores. But what they didn't have at the time was they didn't know how to really interact right with shelters. And the brief was set up a new business model, set up new business model, trial some new business models, how we can break into that segment, but doing good at the same time. It's not just, of course, we need to generate revenue, but also doing good. So that's when I started to work across the whole Mars ecosystem from Banfield, BCA, Blue Pearl, Antec, Heska, and then obviously combining it with Royal Canin and all the different brands and tech and from Kinship. That was very interesting because I learned a lot about the veterinary profession. And that brought me back as well to the work we're doing in Greece. At Mars, I was very fortunate because I had a team in India, I had a team in the Philippines. I had to build these business models, which were some were very successful. One is actually now scaled. Um, but I learned really the nuances between the different countries. Veterinary care is very different in the Philippines, India, or Greece versus the US. So yeah, so from the pharmaceutical industry into the animal health industry, seen quite a lot of things. And now at Zero Share Project, as I said, we're setting up our own veterinary team, which is very interesting. Oh, and the business model that I scaled, one of this is might be now becoming known. It's the Adopt a Pet Shelter Plus model, which is now being scaled. So I'm proud of that.
Well, you have led transformations across global companies from Mars Pet Care to WPP and Johnson & Johnson before co-founding Zero Stray Project. What moment or insight caused you to shift your career toward ending pet homelessness?
Um, there's one name, Caprice. So Caprice was our dog. We found him in 2014 during our wedding week in Greece. We took Caprice from a hoarder. We didn't know at that moment that the woman that we adopted our dog from was a hoarder. We found out a year later. But we brought him home. Um, he was an ex-stray, abused. We had to do a lot of training with him. Later on, he became a service dog, so that is a completely different story. But he opened my eyes about the whole um, problem of pet homelessness and also how it links back to public health, how it links back to public safety, because pets on the street is not the right thing that we need. So there's one word, caprice. He unfortunately passed away last year of old age. So that was uh, it was a big hit for me. But his legacy lives on, and he's the reason why we're here.
I love that his legacy lives on, and Zero Stray Project has become Greece's largest animal welfare advocacy and is now evolving into an international nonprofit. What core principle or model makes your approach scalable across countries and cultures?
So our philosophy is to shift the focus towards prevention. Similar to what's happening in the pharmaceutical and also in the animal health industry, we have tackled the problem since we started in 2015 more from a preventative point of view, to intervene, to find ways to intervene before a dog or a cat ends up stray or homeless. Another core principle for us is we don't draw any red lines. We work with every stakeholder. We work with a breeding association, with a hunting association, with the farmers association, with everybody, of course, with the veterinarians, with everybody in that ecosystem. So we're not drawing any red lines. So the what we're doing in Greece is we are trialing different models. We've trialed the EGINA proof of concept, which has become a global best practice. I'm happy to dive more into that. And we have also tried other models. But the point is we're trying to really set up systematic models. We're trying to go in, analyzing the problem, um, not just the problem after the dog is on the street, which is obviously needs to be tackled as well. So anything that's done today, TNVR of strays, shelters, rescue, adoption, all these are very, very important points. But we have to admit that over decades of that work, it hasn't reduced the number of strays systematically and sustainably. And that's what we've tried to tackle. We really went in and found a model that works in Egina, a systematic model that's built around long-term outcomes and really reduce the number of strays. And that's probably what distinguishes us from other organizations.
Well, the proof of concept reducing stray dogs from 300 to just 30 in 3 years is now considered a global best practice. What were the critical levers that made that intervention so successful?
So what we did is, as I said, we trying to work with municipalities, with governments, with law enforcement, with the judiciary, with the Supreme Court, and with veterinarians. So what we did in Egina, we had, and I don't talk much about the shelter in Greece before because that was only for 2 years. But then after we basically shut down this hoarding situation and built that shelter and made sure that the shelter is sustainable, we moved on. We had to find um, a contained environment. So we decided to go to an island with around 20,000 inhabitants, quite small, around 2,000 owned dogs. And we got the mayor on board to say, look, we're bringing the money, we're bringing knowledge, but you need to give us your team. You need to give us access, or you need to make sure that your director of public health is part of our project team. We want to trial something. It took us 10 months, to be honest, to convince him because we had no brand. We were just two people from New York coming to Greece, trying to convince a mayor in Greece to do that with us. He was not an animal lover either, so he couldn't care less about animals. But we managed to convince him that it's a public health problem, that's a public safety problem. And he understood that. So he said, okay, go ahead. So the first thing we did is we set up the tech. So we set up a dog registry for the municipality so that dogs could be accounted for and be traceable. As I said, Ms. Hazina, the director of public health, was part of our team. She was the project director. So after we set up this platform, we had to obviously fill it. So we tried different interventions to see what sticks. We realized, without going into all the details, we realized that we needed a form of carrot and stick. We needed to promote response pet ownership and explain and make sure that people understood, but we also needed enforcement. So we offered subsidy programs. We made sure we worked with the police. We had the very first police in Greece that we donated microchip scanners to that went around the island, knocked on doors, and say, can I uh, can I look at your dog? Can I scan your dog? And then would give fines and warnings. That was unheard of. So that element of abandonment and microchipping and traceability, we managed. We at the end we had 75% of our own dogs accounted for. They were microchipped and registered in that database. The second part was more the kind of okay. So now we have people understanding that abandonment is not okay anymore. Now we need to make sure that people are also making sure that they're responsible breeding. So we understood, we ran a lot of data with owners all through the municipality, and we understood the reasons for people not neutering and who's not neutering. And then we reached out, we segmented by reason, reached out and managed to get people into clinics with local veterinarians to neuter. And we reached over 50% of neutered owned dogs. So 75% of microchip, 50% of owned neutered. And that reduced the number of new abandonments and new strays. In the meantime, the shelters on the island continued to basically get the dogs off the street. And that all of a sudden reduced the production of new strays from 200 to 30. And that was unheard of.
Wow. Well, the municipal compliance in Greece jumped from under 40% in 2022 to 67% in 2025 under your leadership. What did you learn about driving behavior change and accountability at the government level?
It requires systematic solutions. It requires data. It requires taking the emotion out of the problem. It's a very emotional problem, but you can only win if you can influence people. Even though we work in animal health or in animal welfare, but we're dealing with people. We're also dealing with animals, but we're dealing with people. So what we brought to the government is an understanding that strays are just not good for public health, public safety, for tourism. If you look at TripAdvisor, people saying all the time, "Oh, I don't want to go to Greece anymore." And Greece is only not the only country. There are so many countries in the world because I see all these strays. We learned a lot about crime. That's something that's fascinating because now we're working with prosecutors because we're also working with the Supreme Court who are also training federal law enforcement here in the US, who are training the FBI. And I learned that the more strays, the more crime, actually, because people with predispositions can now get easy access to an animal and train before they go over to humans. So we had a whole sweet spot of why is that a problem? And then we had a solution. So we found it after the success in Egina, we had to codify in some ways. We founded an academy, and to my knowledge, it's the world's first academy in the world that trains municipalities, law enforcement, and judicial. And we had now a path forward. So we trained from of 332 municipalities, we trained 187, and we're giving the government a path forward. And then we had more governments knocking our doors to say, "Hey, you're doing this. How can I learn from this?" Maybe a last add-on. 2 years ago, I was very lucky. I was invited to the World Urban Forum organized by the UN Habitat. There were about 20,000 people, five heads of state, including El Sisi, who was the head of state of Egypt, plus 300 mayors of large municipalities. And I was able to speak in front of them. It was all about strategic development goals. And now we talked about strays. And I remember some government official asked me, why don't we just cull every animal and just like get now around? Why? I mean, I understand the health problem, rabies, etc., but why don't we just cull? And I don't think we should shy away from difficult conversations. So my answer was, and without, it was a longer answer, but in a nutshell was take away culling now, even if you had a magic wand and you took all the dogs off the street. Let's say you have 5 million dogs, and to take all the stray dogs off the street today and bring them into loving homes. You think you have solved the problem, but no, because tomorrow you will have new stray dogs. If owners are continuing to irresponsibly breed, abandon, or also not get access to veterinary services, which is another big problem. So I think if we do that, we can win.
Well, Celia, you have not shied away from difficult conversations. And in fact, one of the things that you did was introduce the first mandatory police training program in animal welfare regulations, certifying more than 2,500 officers. That's impressive. How did that initiative initially come together, and what impact have you seen in that officer training so far?
So coming back to the first proof of concept in Egina, we learned very early on that just by giving a carrot. So we offered free neutering, free microchip, and free veterinary service to owners who couldn't afford it. And that was very important. But we also realized that as much as we can try to promote response pet ownership, there are always people who don't want to do it. And we can't get these people to comply unless there's law enforcement. So we started early on in 2018 to train officers in Egina. So we were actually the reason why there was the first police force built. I learned a lot because I actually went myself and trained. We took Caprice with us and we trained how do you do microchip scan and what is animal abuse. And doing these trainings, you learn a lot of questions from officers. Why should I do this? What's in for me? But that's not my job. I go after crime. So we laid out, we realized where the pain points are, and we could actually answer these pain points. And then moving on to 2021, when we founded the academy to codify, we went after municipalities, and then we went after the police. And we had a meeting with the current Minister of Citizens Protection, Mr. Chrysoidis. He's also not an animal lover, and that's okay. That's totally okay. But when we signed the MOU, it was very clear that you said to me or to us, guys, you have to find a way to help me to train my officers. So we started that through the police academy and through our academy in collaboration. we just had a police in-person training last November. So I was in Greece. We had the most amazing people coming to that training. It was a 3-day training, sorry, a 2-day training in Athens and a 2-day training in Thessaloniki, with senior leadership and junior leadership, with people from all around the world talking and speaking, and people from the FBI. And it was so amazing to speak to them. And it's not that officers don't want to do that. You just have to explain why. So if you look at the numbers, I just look into the numbers here on my sheet. The reported animal welfare incidents increased by 94% in the last 2 years, whereas the years before. The case files opened increased by 34%, arrests by 33%, and administrative fines by 61% to 12.6 million euros, which for Greece, a smaller country, is quite a lot. So it's working because there is now, it's not just education anymore. There's a passive awareness towards active enforcement of animal welfare legislation.
You've got some strong data to back that up. Well, at Mars Pet Care, you helped reshape how the company partners with shelters, including designing the Mars Preferred Shelter model. How did your corporate experience influence the work that you do now in the nonprofit space?
The work at Mars was very rewarding, and it really helped to solve some pain points from shelters, including pain points like mental health. So we built a mental health hotline for shelters, something that hadn't happened before. We know it from the veterinary side, but didn't know it from the shelter side. So I think that is a very interesting model. Um, Over the last 20 years, um, I've worked in various different roles, from corporate strategy over to marketing, sales, general management, and you learn a certain skill set, which is you have to look into you really you need to understand first of all a problem, and then you need to find ways or interventions how to solve that problem. And if we bring that knowledge over to the animal welfare world, it's exactly the same. What are the problems that we're trying to solve? The problem is pet homelessness. How are these problems arising? Well, various different reasons. But in countries like Greece or in other countries like India or Philippines, I would say is quite similar. It's not, there's still a level of response pet ownership that needs to be explained and needs to be promoted. And even here in the US, I would say it's the same thing. I mean, if I live in New York, so if I go out, of course, people are walking their dog, etc. So responsible pet ownership is very different here than in Greece. In Greece, people keep their dogs in gardens, on chains, letting their dogs roam. If you don't have your dog neutered, of course, you get strays. You get more people and more dogs that reproduce. So you have a supply and demand mismatch. But I think the corporate experience helped me very much to structure problems more systematically and finding more systematic solutions to it.
Hey everyone, we are interrupting the episode briefly to talk to you about today's sponsor. This episode is brought to you by The Vet Recruiter. The Vet Recruiter is the go-to executive search and recruitment firm in the animal health industry and veterinary profession, dedicated to connecting exceptional employers with high-caliber candidates. With a deep understanding of the animal health industry and veterinary profession and a vast pool of talented candidates, we make the hiring process seamless and efficient for the animal health and veterinary employers who have critical hiring needs. If you are an employer in search of top talent, or you work in the animal health industry, or are a veterinarian ready to take the next step in your career, look no further than the Vet Recruiter. The Vet Recruiter has placed many of the industry's top leaders, from CEOs to COOs to chief veterinary officers to VPs of marketing and sales and heads of R&D and chief scientific officers. We have built sales forces for many leading animal health companies and have placed more veterinarians in clinical practice than any other search firm in the U.S. Ready to take the next step? Visit thevetrecruiter.com today. That's thevetrecruiter.com. And now let's get back into the episode. Well, you've built and revitalized organizations across Europe, the U.S., and Asia. What patterns do you see globally when it comes to the root causes of pet homelessness, and what still surprises people about this issue?
Uh, I truly believe for my work at Mars and Zero Share Project, and even the work I've done before when I traveled in pharmaceutical, I traveled to Taiwan, I traveled to various different, and I'm trying to see what's happening. I'm trying to get out into the market. So the root cause is always the same. The root cause is irresponsible pet ownership. And not because people are bad, not at all, but because people need to understand what responsible pet ownership entails. So we have to define it. And so the root cause is the same. Every stray on the street was once someone's pet or the puppy or kitten of someone's pet, even if that abandonment happened generations ago, and in the meantime, they reproduced on the street. What surprises me is that after decades of running TNVR and shelters rescue and adoptions, which this all very important, absolutely important. But what surprises me is that we don't have more organizations like ours who are shifting more towards prevention. Because I do believe that only with shelters. Shelters are incrementally important, but no shelter in the world will ever be big enough to accommodate every stray. And we have a supply and demand mismatch. So how do we bring down that supply with humane ways? Ideally not with culling, but with humane ways through responsible pet ownership. So root causes, in my opinion, are everywhere the same. Even if we go to India, where you have a lot of community dogs, the question is, and what surprised me is that not more is done on the prevention side.
Okay. Well, your work spans research, business modeling, and frontline animal welfare. What data or insight have you come across that fundamentally changed how you think about responsible pet ownership?
We've run a lot of data. So our organization is very data centric and data driven. So over the last 8 years, we've collected 10,000s of anonymous pet owner data, which is very interesting to analyze. And I think there are a couple of very important things that are standing out. And they might be more relevant to Greece than maybe to the rest of the world. But still, I think there's something that the rest of the world can learn. We asked a question, why do you not want to neuter your dog? Um, And surprisingly, it's not because I can't afford it or it's a puppy. The main reason in Greece why people don't want to neuter is they say it lives in a contained environment, so I don't need to neuter. On the other hand, so it's over 70% say that. On the other hand, you have we have through our longitudinal studies with pet owners, we ask always the question, do you have a female dog? Did the female dog have a litter? And was the litter intentional? And we have really thousands of data points on that. And the result is that of everybody who had a litter, 64% of people said it was not intentional. So on the one hand, you have the controlled environment. I don't want to neuter. On the other hand, it's not intentional. So that gives you a little bit of a story, so why it's not happening. And that is, I think, something that comes back to response pet ownership. And again, not everybody needs to neuter. I'm not advocating that everybody must neuter because in Greece, for example, we have now a new way. So you either neuter, you give a DNA sample, which is a blood sample that traces offspring back to the mother. And if the mother is traceable in the national database, the EMZS, then actually the owner is becoming responsible. So I'm not saying that every dog or cat needs to be neutered, but we have to think about population control in countries where there are a lot of strays. So these two data really are, I think, outstanding.
Well, Zero Stray Academy is positioned to train municipalities, shelters, and professionals internationally. What skills or capabilities do you believe are most missing in today's animal welfare ecosystem?
I think I alluded to that earlier. It's a little bit the let's be systematic, logical, and take the emotion out of things. It's hard. If I'm on the ground and when I'm on the ground, I see a lot of things that and I'm a massive animal lover that really strike me. But at the end of the day, in order to influence policies, in order to influence governments, in order to influence pet owners, we have to work systematically. And that is, I think, something that the industry is still very emotional and understandably. But if we really want to drive a shift, we have to take the emotion out and we have to learn how to really influence people. Yes, we're working with animals, but at the end of the day, we're working also with people. People are the customers.
That makes sense. Well, you've been called a purpose-driven leader throughout your career. How do you stay grounded and focused when working on a mission as emotionally challenging and urgently needed as ending pet homelessness?
I I think it's very important to understand um, your customers. So what I generally do is I like to spend as much time on the ground as possible. So we are now running a second pilot in Crete where we work with groups that are well known, or at least they are accused of being the reason why strays exist. Hunters, farmers. There are a lot of farmers in Greece who use dog for herding sheep. So the dogs live in the mountains with the sheep. Of course, no veterinary care. Not of course, but many times no veterinary care. The dogs breed uncontrollably. So we're working with these groups right now. So these groups are coming to our clinics. We're offering clinics, free microchipping, free neutering, and also free veterinary services for people who cannot afford it, tumor removal, etc. I mean, everything from removing a leg or removing an eye to anything that the dog or cat needs. So I'm talking to many of these hunters when I'm on the ground, and it's not always easy because I don't speak Greek, but thankfully my team can translate. And Stacey, it's mind blowing. You hear these people saying, I didn't even know that I have to do this. Nobody told me this. So you can't blame people for not knowing. And they're actually thankful. They're not bad. They're thankful. They come and say, thank you so much for saving the life of my dog. You're doing an amazing job. So it's really it's in my opinion, it's always important to be on the ground, to talk to the people that you work with and understand their perspectives and not just judge, but understand their perspectives. And then that's a humbling experience, in my opinion.
Comes down to awareness and education.
Correct.
Well, Celia, what has been the most surprising thing to you during your work, during your career in the animal health industry or working in animal welfare?
Um, as I said, for the first decade, I was in pharmaceuticals, saw this change around um, the way from blockbuster drugs more to precision medicine. I mentioned that earlier. I think we have seen the same or similar shifts in the animal health industry. So while the animal health industry is always lagging a little bit behind, but we can see a similar shift. So 20 years ago, animal health was all around very reactive. The animal gets sick, the vet diagnoses the problem, the drug treats the disease, problem solved, right? So it was all about how fast the symptoms resolved, how powerful the drug was, and it worked, but it was expensive. But essentially, most animal diseases aren't random, right? They're predictable. So I think it's a very positive change that we experience right now in the animal health industry, where we see how vaccines and nutrition and genetics and biosecurity are coming together and actually delivering more economic and welfare value than blockbuster drugs 20 years ago. So vaccinations become more central part of animal health. 20 years ago, it was not. Now it's nutrition. I worked at Mars. I worked across all the nutrition brands. I really understood the value of good nutrition and everything that you have, micronutrients, microbiome management. You have genetics. Genetics revealed that not every animal responds the same to a specific drug. So there's specific breeding programs now, really targeting selective breeding, etc. And also the biosecurity. I mean, many diseases were created by management practices. And now there's much more rigor to it. There are many more like animal movement controls or quarantine protocols. So things have changed. So the vet's role fundamentally changed from treat and cure a sick animal um, to design and manage health systems. And I think this is a very, very powerful shift that we're going through. And it's a very exciting shift. So, especially when it comes to animal health and animal welfare, that's exactly what we need. We need to design the next way of um, health systems. And then the second thing that I personally, as a pet owner and also working for pets, the whole explosion of pets. We saw it in COVID, right? So we had a lot of pets, many more pets were acquired. I don't think anybody would have predicted that 20 years ago. The humanization of pets, which I find a beautiful thing. The human animal bond, which has been widely researched and found to be very important for health reasons. So these two trends are very exciting in my opinion, and something I'm looking forward to the future where it goes.
Well, let's look into the future. What does your crystal ball say about the future of the animal health industry?
Well, I think there will be more consolidations. We're seeing this already. Um, so consolidations will happen. Um, I believe the pet care market will increase or will grow even further. I mean, the whole animal health industry in the last, what is it, 20 years has grown at a CAGR of 5 to 7%. I think we will see more growth through pet care or pets to that point. So that will happen. Um, I predict that there are business model changes. I'm very fascinated by new business models and generating new revenue streams and finding new ways of go to market. But I think there will be a couple of new business models that will happen. Um, I think we see some of them already. So subscription platforms will grow. Banfield already has that. Banfield, for example, is a vet hospital. They have wellness plans. So you have a monthly subscription, and then you that includes diagnostics, telehealth, and preventative meds. Not on the Banfield side, but I think that will happen more in the future. And then also, I think there might be an opportunity for more outcome-based contracts. Um, that's something we explored at Mars a little bit, but so an example would be a dairy farm signs a contract where the company receives a bonus if mastitis cases drop below a threshold, or a pharma company, an animal health company receives a bonus when it goes below a certain hurt community hurt actual hurt outcomes in vaccines. So I think this could happen as well, outcome-based contracts. So a couple of predictions. I mean, I wish I had a crystal ball because that would make my life easier. But I think we have exciting times ahead.
Well, I like what you said about the subscription service. I just launched a job board for the veterinary profession that operates on a subscription service. It's called Vetivate,
Fantastic.
Vetevate. So
Fantastic.
that's up and running. Well, you've had a successful career. What are a few of your daily habits that have allowed you to achieve success along the way?
Um, I really cherish one thing that I do every morning. I walk my dog for an hour in Central Park. It's something that helps me to not only to have fun, because I really like it. It's fun to be out with him. And we have, after Caprice passed, we took actually another dog from Crete. We took a stray dog from Crete. He's called Milo. We found him during one of our clinics. So he is now, and he's shocked about the cold in New York. He has never seen cold by like this before. But I really enjoy walking in the park for an hour in the morning because it clears my head. It sparks new ideas. I can order my day. I can order maybe something like a big project that I have coming up or a big deadline, and it just helps me to be creative. So that's one thing I really, really enjoy. It's something that I've done for as long as we have a dog, and I wish I should have done this before. Um, and then the second thing, I genuinely enjoy learning something new. So now I have a partner in crime. My 7-year-old likes to ask a lot of questions. So we're now making it a habit every day to learn something new, a new fact, a new whatever it is. Either we use ChatGPT or we go into a book or we're coming across something, we're talking to somebody. And I'm trying to always make it a habit to say, okay, I learned something new today, which is building this curiosity. And yeah, and maybe if I go back 10 years from now, maybe I should have gotten a dog earlier. That might be something. But that's the kind of two things that I really enjoy.
I love that. What has been the biggest challenge you've encountered throughout your career?
Uh, let's talk about Zero Share Project for a moment, and then I can give an example of Mars. In Zero Share Project, we grew very fast. And quite substantially. So from zero in 2020, we are now having almost 24 FTE. So we're building up to F20, including a veterinary organization. I think the challenge was that we had to hire people very fast and couldn't find always the right talent and had to make fast decisions. So we had in the beginning a very junior team that I had to build up. Now I'm half around the world. I'm in New York. I'm working in a country where I don't speak the language. Um, so that was a little bit of a challenge right in the beginning to really build that team up, to get a team that you have to mold and you have to form without being there, and that becomes successful. So that now I think we're in a very good stage. So now we have a very good team in place. So some of our country manager, for example, she's been with us the longest. She was just promoted. So we see that the fruits coming out of it. But I think that was in the beginning quite hard. Another example, when I was at Mars, when I started, the role was, to be honest, not really shaped. All I was told was, we want to generate new business models and with shelters, figure it out. So that was interesting, because I had to build, I didn't have a team in the beginning, so it happened much later, but didn't have a team. So I had to really find out what is it that we're looking for. I had my own ideas, and making sure that I bring everybody on board. Um, Mars, as many organizations, Johnson was the same, WP was the same, we're all structured by P&Ls. So working across the ecosystem, it's not always easy when you have to bring people together. But I think the result is beautiful.
Well, it's not easy, like you said, to bring people together, but you've accomplished so much. And, looking back earlier in your career, what advice today would you give the younger version of yourself?
Network more. I thought I did a lot of networking, but I didn't do nearly enough. I should have done it more and earlier. That's one advice. The second advice is be intentional who surrounds you. I was lucky to have people who were better and smarter than I, but it was more like by accident. It was not by design. So if I would give myself advices, um, yeah, try to be intentional about who is around you.
Being intentional, networking more. I cannot agree more. It is so important. And I tell this to veterinary students. You got to start in vet school. You got to network, go to conferences. Don't just go to get CE.
Right.
Go to meet as many people as you can. And that's where
Exactly.
new ideas come from often. Well, some of our guests say they've had a key book that they read that helped them along the way. Is there a key book that you've read in your life that's impacted you the most?
There was one book I read early on in my career, which is called Coopetition. Um, that was just a couple of years after I worked at Johnson Johnson or started working at Johnson Johnson. We had a lot of war games. How do we increase share? I was heading up market research and then marketing for Europe, Middle East, Africa, and basically it was all about how do we steal market share? How do we drive the category, but also how do we steal market share? So that book was very interesting for me because all of a sudden it widened my perspective about, yes, of course we need to if we want to grow the market, we need to do it in a way that we are driving revenue for us and often at expense of our competitor. But there's also a good way to sometimes collaborate when it makes sense. I mean, nowadays you have Apple and Google collaborating on apps, right? And I think this concept will become much more important as we go further because markets are saturated in some ways. So how do we combine competition and collaboration in a way that makes sense and also delivers more value for our customers?
I see so much collaboration in our industry,
Correct.
competitors collaborating, and I agree. I think you're right about that. Well, Celia, you have the mic. What is one thing that you want to share with our listeners of the People of Animal Health podcast before you drop the mic?
I think true leadership in animal health is about creating impact that outlasts you. And if you have that guiding principle, I think nothing is impossible.
Create lasting impact. And you're certainly creating a legacy with the work that you're doing that I sense will outlive you. Congratulations on all that you've accomplished along the way. And thank you for being my guest today on the People of Animal Health podcast. I enjoyed our conversation today.
Thank you so much, Stacey. Thank you for having me.